Most people think regular health checkups are always good. But here's a surprising truth: after 70, some of the most common medical exams can actually do more harm than good. Instead of protecting your health, they may create anxiety, lead to unnecessary treatments, or even cause dangerous side effects. In this video, we'll uncover 5 routine health tests seniors should think twice about, and share safer alternatives you can rely on. Let's begin. 1. The colonoscopy trap. Colonoscopy is often called the gold standard for colon cancer prevention. And yes, for people in their 50s and 60s, it can truly save lives. But once you reach 70, the balance shifts, and the risks can outweigh the benefits. Why? First, the preparation itself is harsh. Seniors often need to drink liters of laxatives to cleanse the bowel. This can lead to dehydration, kidney problems, and dangerous drops in blood pressure. Next, the sedation used during the procedure is much riskier for older adults. It can trigger delirium, confusion, or dangerous reactions with existing medications. And finally, the scope itself may cause internal bleeding or even perforation of the intestine. These complications, while rare, are far more severe in seniors. Another hidden truth is that colon cancer in older adults often grows slowly. Many people may live their natural lives without ever being harmed by it. But once a suspicious polyp is found, the anxiety, hospital visits, and risky treatments can steal years of peace and independence. Doctors increasingly recommend non-invasive stool tests for seniors instead. These tests can detect dangerous changes early, without the risks of sedation or invasive procedures. So while colonoscopy might have been life-saving in your 50s, after 70, it may become the start of unnecessary suffering. 2. The PSA test, prostate screening. For men, the PSA blood test is often promoted as a way to catch prostate cancer early. On the surface, this seems like a good idea. But after 70, the reality is very different. Most prostate cancers in older men grow so slowly that they never cause symptoms, let alone shorten life. Yet, a slightly elevated PSA number often sets off alarm bells. What follows can be far worse than the disease itself: repeated blood tests, painful biopsies, radiation, or even surgery. And these treatments can leave lifelong scars: urinary incontinence, erectile dysfunction, chronic infections, and constant worry. Imagine this: a man in his mid-70s gets a PSA test during a routine checkup. His number is slightly high. He is referred for a biopsy, which causes infection and requires hospitalization. The biopsy reveals a cancer so small and slow-growing that it would never have harmed him. Yet the stress, hospital stays, and side effects reduce his quality of life dramatically. That's why many urologists now advise skipping routine PSA tests after 70, unless there are real warning signs, such as difficulty urinating, pelvic pain, or unexplained weight loss. In those cases, targeted treatment makes sense. But blind testing often leads to more harm than healing. 3. Mammograms after 75. For women, mammograms are often described as essential for life. And yes, in middle age, they save lives by catching aggressive cancers early. But after 75, the evidence shows something very different. At this stage of life, mammograms often detect tiny, slow-growing lumps that would never have become dangerous. Yet the discovery launches a stressful journey: biopsies, surgeries, radiation, or chemotherapy. Each of these carries heavy side effects, from fatigue and weakened immunity to broken bones and heart strain. For older women with fragile health, these treatments can shorten life instead of saving it. A study from Harvard found that mammograms after 75 rarely add extra years to a woman's life. Instead, they often bring fear, pain, and unnecessary medical intervention. Doctors now recommend that mammograms past 75 should not be automatic. Instead, the decision should be personal, based on a woman's health, history, and preferences. For many women, stopping mammograms and focusing on overall wellness healthy eating, exercise, managing stress, may actually be the best path to staying strong and independent. 4. Bone density scans, DEXA. Osteoporosis is real, and bone density scans are helpful in diagnosing it. But after 70, repeated scans every couple of years can become more harmful than helpful. Here's why. Once osteoporosis is confirmed, repeated scans rarely change the treatment plan. But they often lead to pressure for stronger medications, such as bisphosphonates, which carry serious side effects. These include jaw-bone problems, digestive issues, and in rare cases, unusual fractures that occur without warning. For example, an 80-year-old woman who had already been diagnosed with osteoporosis was pushed into repeated bone scans. Each time, the doctor recommended stronger drugs. But the side effects left her with stomach pain, brittle teeth, and reduced appetite, while simple lifestyle changes like resistance exercises and vitamin D could have helped her more safely. Instead of chasing numbers on a scan, seniors benefit most from focusing on fall prevention, strength training, balance exercises, and nutrition. These real-world measures reduce fractures and improve independence, far more than another test result ever could. 5. Heart stress tests without symptoms. Finally, let's talk about heart stress tests. These are often given to seniors, just to check, even without symptoms. The test usually involves walking on a treadmill or taking medication to make the heart beat faster, while doctors monitor for problems. But here's the issue: in seniors, stress tests produce many false positives. That means the test shows a problem when the heart is actually fine. This can lead to invasive follow-up tests like angiograms, or even surgeries such as stent placement or bypass operations. Each of these carries significant risks, including heart attack, stroke, and long hospital stays. Consider this: an older man with no chest pain or shortness of breath takes a stress test, just to be safe. The test suggests a possible blockage. He undergoes an angiogram, followed by a stent procedure. During recovery, he develops complications and loses much of his independence. All this, despite never having symptoms in the first place. That's why cardiologists now caution against stress testing unless you have real warning signs, like chest pressure, unexplained fatigue, or breathlessness. For healthy seniors, the best heart test is often simple lifestyle care, regular walks, blood pressure control, heart-friendly foods, and staying socially active. So, what's the lesson here? After 70, not all medical tests are your friends. Colonoscopies, PSA tests, mammograms, repeated bone scans, and unnecessary heart stress tests may create more fear and harm than real benefit. The key is personalized medicine. Always ask your doctor. Backhand index pointing right: will this test actually improve my health and quality of life at my age? Remember, your health isn't just about living longer, it's about living better. Sometimes, the wisest choice is to say no to unnecessary tests and focus instead on strength, balance, nutrition, and joy. If you found this video helpful, please subscribe, hit the notification bell, and give us a thumbs up. And share your thoughts in the comments. Have you ever been pressured into a medical test you weren't sure about? Stay informed, stay confident, and remember, after 70, wisdom is your best medicine.